adult stem cells are a part of the way we treat people every day. That stem cell research generally is something that has been very productive for new life-saving therapies. So these are people with malignancies, cancers, like lymphoma, like multiple myeloma, like Hodgkin's disease, to see if we can't now improve their outcome. So what we've been focusing on is the fact that stem cells, we define them by what they do in a very complex setting, what they do in the body. And what we've discovered is that the environment provides some very fundamental cues that teaches the cell what to do. We're now trying to harness those and to manipulate those to make them work in a more efficient manner in a setting where we might need them. And that we found we can do with certain kinds of drugs. Some drugs that are actually already available now look as if they can have an impact on that environment and make a difference for the stem cell. And so that's what we're now testing in patients.
One of the populations of cells, of adult stem cells, that actually works extremely well are skin grafts. So it's possible to take a piece of skin and take the keratinocytes, which are the skin cells, and grow them in culture, and they will fill the plate. And if you grow them under the right conditions as a sheet, you can actually have a sheet of cells that can be placed on a burn wound.
All that was necessary to be able to generate these sheets and sheets of skin was to take a tiny area of the patient's unburned skin, place those cells into culture, expand the cultures, produce dishes and dishes of skin stem cells that were the patient's own stem cells. So when these cells are grafted back onto the patient doesn't reject these cells. They're his own stem cells or her own stem cells. In cases where patients have very serious burns, where the bulk of their body surface has been burned, it is the only way to be able to keep these patients alive and to allow them to eventually function again.
But with all their promise, adult stem cells have limitations. They are rare. We don't know if they exist in all tissues, and they are difficult to grow and study. Embryonic stem cells don't have these same limitations. Scientists are actively working to better understand how to work with both embryonic and adult stem cells. A small sampling of exciting work being done includes making stem cells that genetically match a patient, using stem cells to understand and treat cancer, studying how skin stem cells repair wounds and grow hair, and studying how embryonic stem cells make different tissues.